Um, I really want this, there we go. I really want this to be an informative session for you in terms of sort of what is the relationship between stress and infertility. I always preface whenever I give a talk two things. One is I'm from Boston and we talk really fast. And so if I talk too fast for you to understand me, please just like raise your hand or whatever one does and say slow down. I'm also on prednisone for an eye infection, which makes me even more hyper. So I, again, apologize in advance. And the other thing I always say is that I think almost the best part of these webinars is the Q&A at the end. And so I'm going to sort of go through these slides pretty quickly because some of the information may be known to you already. And just please, there's a Q&A chat thing at the bottom. Please ask questions because if you're wondering about something, there's a really good chance somebody else is too. So next slide, please, Arena. So basically, I want to talk about the psychological impact of infertility and what's, a normal reaction to infertility. How does infertility impact your life? Can stress impact fertility? And then I want to talk about a few things that you can do to make it just a little bit easier. And I've honestly spent 37 years of my career I wear two hats. I do a lot of research on the relationship between stress and infertility, but I'm also a psychologist. And I've been seeing patients individually, couples, groups since 1987. So like before a lot of you were born. And so I know a lot of things about how to make this just a little bit easier. So next slide, please, Arena. So if you look at the research, and I'm not going to be a nerd this whole time, most women and men who are going through infertility report psychiatric levels of anxiety. And the majority of women also report symptoms of depression. It's about 60 something percent of women, and I think 33% of men. So this is a hard disease to experience. And I use the word disease very deliberately because the World Health Organization has classified infertility as a disease. And I get very offended when people talk about people making choices and people are electing. No, infertility is a disease. 90% of the time, there's a physiological reason for it. And we need to look at infertility as we do with any other disease. Next slide, please. So it's also very common to feel, by the way, this is from the movie Inside Out, which is one of my favorites, because when you're a psychologist, you like it when they talk about feelings. Other very common feelings are feeling lonely. I still have a private practice 1 day a week and I still see patients. And, you feel like the whole world is having babies and they're having babies by accident and they're talking about their babies and their pregnancies and everything else. I'm actually right now watching a British show on Apple TV, I think called Trying, because if there's a TV show about infertility, I have to watch it. And I think they capture what this couple is going through so beautifully and how lonely the wife feels, how isolated you feel, how insanely jealous one can get when other people get pregnant, how angry one gets at one's body and one's partner and one's doctor and everybody who gets pregnant easily and has to talk about it. And that, by the way, is a big pet peeve of mine. I don't think anyone needs to know how many times you had sex before you got pregnant. And it drives my patients crazy. Like, oh, my cousin said, oh, they got pregnant the first month. Doesn't matter. We don't care. That's called bragging. Anyway, and how frustrating it is to want to have had a baby yesterday. And just no matter what you do and how many things you do right, it just isn't happening easily. Next slide, please. So people don't talk about this, that one of the hardest things, especially for women who are struggling to get pregnant, is how excruciating the pregnancies of other women can be. And if you aren't bothered by other people's pregnancies, you should consider yourself lucky, because I'd say the majority of my patients just dread pregnancy announcements. They dread going to events where they're pregnant women. It's just super uncomfortable. I had patients who've never been jealous a day in their lives. They loved it when their friends got A's, and they loved it when their friends got cute boyfriends or when they got married first or whatever. But if those friends get pregnant easily or accidentally or whatever, it can be really hard. And, I would say that a lot of my patients and women in general, it can become almost phobic, that they just don't want to be in a position to have to deal with an unexpected pregnancy announcement. So if you are going through infertility, and if you want to or need to avoid Any activities that focus on pregnancy or babies or small children, in my world, that's normal. And don't let anybody, your partner, your mother, your friends, don't tell them that you're being selfish or whatever. You're not. It's an entirely normal reaction to infertility. And in general, men tend not to feel this way, or they don't feel it as intensively. Next slide, please. So I published a paper about 25 years ago that showed that women with infertility have the same level of anxiety and depression as do women with cancer, HIV positive status, or heart disease. And I want you to remember that the next time you get your period and you're miserable, or you hear someone's pregnant and you're miserable, that the psychological impact of infertility is the same as a potentially terminal disease. That's how hard it can be. So if you're feeling depressed or anxious or miserable or resentful, again, you're having a normal reaction. Doesn't make it easier, but at least I can tell you, you're not crazy. This is really hard. Next slide, please. So we did a study in Boston, where I live. Boston was hit very hard by COVID very early because there was a big conference at a company called Biogen, and they had like 70 people in one room in March of 2020. And one of the people who came to this conference was from China and apparently had COVID. And I think all 70 people in the conference got COVID, but they actually eventually found out that 300,000 people in the Boston area caught COVID from this one person. So COVID hit us very hard, very quickly, very early. And we did a survey of several thousand patients who were going through infertility. We said, what is more stressful for you, COVID or infertility? And this is the days where going to the grocery store felt like you had to like mask and glove and bathe in Purell. And our patients said that the stress of infertility was the same or even higher than the stress of the pandemic. And I don't know if you guys remember, but the spring of 2020 was really hard and scary. But our patients said that infertility was just as tough, if not worse, which didn't surprise me at all. It surprised a lot of our physicians. Next slide, please. So, as I said, the World Health Organization classifies infertility as a disease. Most people who have infertility have a physical diagnosis. And yet, I would say 99.9% of my patients have heard from somebody, just relax and you'll get pregnant, or you're working too hard, or you're too fat, or you're too thin, or you're not eating the right foods, and you're exercising too much, or not enough. And every single one of those comments is blaming the victim. You would never say to a cancer patient, oh, just relax and your cancer will go away. You would never say, if someone broke their leg, oh, you're working too hard. But for some reason, people feel like it's okay to say that to people with infertility, despite the fact that infertility is a disease. Next slide, please. So what is the impact of infertility on one's life? And I've sort of come up with all the different categories. So it can have a big impact if you have a partner, whether you're a same-sex or a heterosexual couple. It can have a big impact on your relationship with your partner. If you are in a heterosexual relationship, men and women do not react to infertility in the same way or at the same time. I've probably seen, I don't know, 1,000 couples. I've never seen them be at the same place at the same time. Women tend to want to talk about it more. Men tend to be more focused on problem solving. And so when you sit down with a couple and I say, so, how much do you guys talk about infertility? The woman often says, not enough. And the man sort of rolls his eyes and said, too much. But, women tend to be more emotionally expressive and men tend to want to, he's like, okay, this is the problem, let's go see the doctor. But if this is how your relationship is, this is pretty typical. Next slide, please. It can also have a big impact on your sexual relationship because many couples, for a lot of people, they start trying as soon as they get married. And so, the fun, dating, spontaneous, intimate, hot sex you have when you're dating can pretty quickly turn into try to make a baby sex. And then we're not making a baby sex. And many couples begin to associate sex with failure. And it can be challenging to feel intimate and spontaneous. And then, a lot of people, when you're still trying on your own, women only want to make love mid-cycle. Next slide, please. And in terms of sex, men start to feel like the only reason their partner wants to have sex with them is to extract sperm from them. They both start to associate sex with failure. And it's sad because sex can be fun and spontaneous and intimate, and it can be hard. So the third thing, so sex impacts your relationship. I mean, infertility impacts your relationship, it impacts your sex life. It has a big impact on your relationship with your family because in all likelihood, your siblings are probably getting pregnant. And that's really hard, especially if it's a younger sibling producing the first grandchild. Parents and other family members can say really stupid things. And I say that deliberately because it's amazing to me. Some of the things my patients have told me that their parents or in-laws have said to them. And if their parents are older, the parents may be putting a lot of pressure on them to produce grandchildren quickly. And that pressure does not help. Next slide, please. So it can also have an impact on your relationship with your friends, because as I said, if your friends are having kids, that's all they're going to talk about. And you're going to feel left out or left behind. Your friends may not know what to do or say. And they may just constantly talk about their pregnancies or babies, which can feel painful. And in fact, one of the last webinars I did was for family and friends. It's sort of like, if you love somebody who's going through infertility, watch this webinar and I'll tell you how to support them in a really healthy way that will be good for them. But I think if someone hasn't been through infertility, they just don't know what to say. And so they end up saying stuff that comes across as being insensitive. I would like to believe they don't do it deliberately. Although, sibling rivalry never dies, and you need to be aware of that. Next slide, please. So it obviously can impact your job or your career, because if you're going through a treatment cycle, you need to go to the clinic for tests or monitoring, usually first thing in the morning, or an IUI middle of the day. You can't travel for work if you're undergoing treatment. And I've had a lot of patients have jobs that actually involve contact with pregnant women and babies. And, I've had patients who are obstetricians and nurse midwives and labor and delivery room nurses and pediatricians, and they can't get away. And the other thing is these days, I mean, maybe a little less so with COVID, but, if you're one of these people who is sensitive to other people's pregnancies, you can try to avoid pregnant family members and friends. You can't avoid pregnant coworkers. And if God forbid you have two pregnant coworkers, that's all they're going to talk about at work. And it's really hard to get away from it. Next slide, please. So unfortunately, in this country, probably about half of people who are eligible to go through infertility treatment don't have insurance coverage. It's changing rapidly. It's pretty exciting how many people now do have at least some coverage. But if you don't have insurance coverage, if you don't have your own financial resources, the cost of treatment may make it really hard to proceed. And, you have to be wise in terms of, do you ask your parents for help? Do you ask a wealthy aunt or uncle for help? And I had a couple a number of years ago who just could not afford an IVF cycle. And that was their only treatment option. And both of their parents, so all four parents, had money. And so they went to the wife's parents and they went to the husband's parents and they said, hey, you guys chip in to pay for an IVF cycle. And one set of parents said yes and paid for the IVF cycle. And the other set of parents said, no, we're not going to pay for your IVF cycle. And the couple got pregnant and had a baby. And the grandparents, who had quote unquote paid for the baby, said that they should have more access to the baby because they had paid for it. And that became a really tough situation. A lot of resentment on everybody's part. Next slide, please. So people don't talk about this either. I published a couple of papers on this because people don't really talk about how does infertility impact your religious or spiritual beliefs. And a lot of women say that this is the first time that God hasn't answered their prayers. A lot of people wonder if they're being punished by God for something they did wrong in the past. The only good thing about this is that we actually did publish a big study a number of years ago that showed that the more religious and spiritual the woman is, the less distressed she is by her infertility. So having a community, having faith, having spirituality can be really good. And so if you have a faith that's important to you, I would pursue it. If you are brought up in a faith that you aren't comfortable with now or that prohibits IVF, you may want to investigate other avenues. But having religiosity or spirituality can be actually very protective against the psychological pain of infertility. Next slide, please. So it obviously can impact for both men and women your body image or self-esteem. For a lot of people, women are fertile. For a lot of men, men are, they're studs. They can knock anybody up. And so a lot of people feel like this is really impacting their self-esteem and their sense of being a man or a woman. For women, a lot of these fertility meds can lead to weight gain. And it can also just feel so unfair that what comes so easily or even accidentally to some people can be such a struggle for you. And it's hard. It's a very hard process. Next slide, please. So again, my area of research, really for the last 38 years, has been, does infertility cause stress or does stress cause infertility? And most people believe that infertility causes a lot of stress. I think, I've just shown you all these slides. I could spend the next 3 days showing you research studies, but it's really clear that going through infertility is really stressful. But the stress cause infertility, and that's been honestly the hottest question in this field, in my mind, since biblical times. Because there's been this bias for thousands and thousands and thousands of years that, women, not so much men, but women, when they're stressed, their fertility rates go down. So I've been approaching this more from a scientific point of view. Next slide, please. So the research is somewhat unclear in general about the impact of stress in the reproductive system, because it looks like some people can be reproductively immune to stress. And we know that during times of war or concentration camps, women did get pregnant. And so we know that some people, no matter how stressed they are, can still be fertile. But we also know in almost every species in the animal kingdom, if you stress out an animal, their fertility rates plummet. And I don't think we can assume that humans are any different. Next slide, please. So there have been a number of studies which have shown that stress can lower fertility in both men and women, probably for the last 20 years or so. But some people disagree with me, and they say, well, is it the stress itself, or is it that people who are stressed are not having sex as often, or they're drinking more alcohol, or they're drinking more coffee, or they're smoking, or they're eating less healthy food, or they're sleeping poorly? Any of those can impact fertility. So is it the stress, or is it the behaviors that change? Next slide, please. So there is some data to show that women who have the highest level of stress before and during treatment have lower pregnancy rates than women who are less stressed. And sort of my viewpoint is, even if stress per se doesn't in and of itself affect pregnancy, going through treatment's tough. And so it really makes sense. Like, okay, would you rather go through an IVF cycle feeling relatively calm and with good coping skills, or would you rather go through an IVF cycle feeling stressed out of your mind? And I think it's easier to go through if you've got some skills. Next slide, please. So the other thing that has been a way for me to get research funding is a number of studies have shown that the more distressed the woman is before and during treatment, the more likely she's to drop out of treatment, even after only one cycle. So depression levels before IVF are highly predictive of dropout rates. And so this does motivate clinics and pharma companies and device companies and everything else to say, okay, we clearly need to do something to support these patients better so that they stay in treatment until they have a baby. And that's, obviously that's the goal for all of us. Next slide, please. So one thing that I've been, trying to look at is, what is the impact of psychological interventions? So as I said, since 1987, I created this mind-body program for infertility. And it's a 10-week program. Now it's remote, but it's a 10-week program. And we've done 3 or 4, I don't remember, randomized controlled trials to see, do women who go through this program have less anxiety and less depression? And are they more likely to get pregnant? And most studies like mine have shown that women who participate in some kind of intervention, and the most effective actually tend to be group interventions, which provide a lot of coping skills training, that people who go through these compared to a control group have less anxiety, less depression, feel less angry, feel less isolated. Next slide, please. Most of the research also indicates that women who receive or participate in these counseling also experience higher pregnancy rates. And this is not my research because I'm way too biased, but there's a group out of Denmark actually that has done a series of what are called meta-analyses, where they take 10, 20, 30, 40, 50 different studies and sort of lump them into one statistical pot. And they publish a number of papers now to show that women who do some kind of intensive psychological intervention have much higher pregnancy rates. And in two of my studies, the women who did the Mind Body program doubled their pregnancy rates. And in a study that I did with a graduate student where we did an online program, the women who did the online program quadrupled their pregnancy rate compared to women who did not do the program. And as I said, I think because people going through infertility do tend to have such anxiety and depression, going through some kind of psychological intervention, which reduces anxiety and depression, is worth it in and of itself because you just feel better. I mean, no one likes to feel anxious or depressed, but there might be a really big added bonus of doubling, tripling, quadrupling pregnancy rates, because obviously that's the goal for everyone. Next slide, please. So just to summarize this, women and men who experience fertility have very high rates of anxiety and depression. They're very unpleasant to experience. I mean, I'm sure all of us in our lifetime have experienced them, and no one likes to experience them. These levels of distress may make treatment less effective. They might increase the need to drop out of treatment. We do know that psychological counseling is associated with decreases in anxiety, depression, et cetera. And it probably is associated with pretty high increases in pregnancy rates. So what can you do to reduce stress? Next slide, please. So in general, I sort of break up, I'm a big believer in offering people a lot of different methods, because I cannot come up to a single patient and say, you will do better with meditation, and you'll do better with exercise, and you'll do better with stress management. So what I do with my patients, and this is what I've done my whole career, is teach a buffet of skills. And that way you sort of pick and choose the ones that are going to work for you. And so we have mini relaxation techniques, appropriate nutrition, moderate exercise. Next slide, please. Mini relaxation strategies are awesome. They're actually based on just simple diaphragmatic breathing, just taking some nice, slow, deep breaths. The diaphragm is this actual massive muscle which separates your chest cavity from your abdominal cavity. And when we get tense or anxious, we tighten our abdominal muscles and we trap our diaphragm in place. And so when we relax and take these slow, almost like a sigh, it allows for deeper breathing, which leads to a decrease in blood pressure and heart rate, and increases your sense of relaxation. And so the first thing I teach all my patients is called mini relaxations, because you take your lungs everywhere you go. And so no matter what situation you're in, you can do a mini. So next slide, please. So I'll just lead you through a mini. So as you're sitting here in front of your computer or your phone, if you feel comfortable, you can close your eyes. And if not, just look at your hands in your lap. And just bring your attention to take a couple of nice, slow, deep breaths. Just, almost like a sigh. And as you inhale, say the word 10 to yourself, and then exhale. With the next breath, say the word 9 to yourself, and then exhale. And continue doing this until you get down to 0. And now slowly open your eyes. Do you feel any more relaxed than you did 10 breaths ago? This is called a mini. You sometimes have to practice. It's actually easier to do this. Just lying on your back and just practice it a few more times. But minis are amazing. Honestly, if I could say in my entire career what would be the most important thing I would teach a patient, especially when going through infertility treatment, I would say learning minis. Next slide, please. So again, I won't go through all the minis because I want to leave time for questions, but this one is pretty easy. You know, you just take a slow, deep breath, and as you inhale, you count up from 1 to 4. So as you inhale, you say to yourself 1, 2, 3, 4. And as you exhale, you say to yourself 4, 3, 2, 1. And you do that 3 or 4 times. This is actually what I do when I can't sleep at night. And this mini actually is more focused than the first one, and it's easier to keep your mind from wandering. Next slide, please. So again, another mini. This one is just take a slow, deep breath, hold it for a count of 3, exhale, hold it for a count of 3, and do this 3 times. This is also a pretty easy mini. But these are just ways to, in the moment when you're feeling anxious, to bring down your level of anxiety and just give you a better sense of control over your body and your mind. Next slide, please. So when should you do a mini? So there are 2 different times to do a mini. One is when you're aware that you're anxious. So if driving makes you anxious, do a mini before you turn on the ignition. For a lot of people, just sitting in the clinic waiting to get called in for a blood test or an ultrasound or a visit with your doctor or whatever, just sit there and do minis. For the 3rd, 4th week of your menstrual cycle, before you go to the bathroom, do a mini. Start becoming aware of how your body feels when you're anxious, and do a mini beforehand. The second time to do minis are harder because it takes thinking, is to start realizing what situations push your button. So again, before you turn the ignition in your car, when you see traffic ahead, before and during an injection, ultrasound, blood test, before you pick up the phone to call your doctor or look at your portal for test results, and for a lot of people, before you check social media, in case there are, in fact, you know, pregnancy announcements or baby bumps or gender reveals or anything else. Next slide, please. So there are thousands of relaxation techniques. You know, I can probably teach 20 of them, all of which elicit the relaxation response, which is the physical opposite of the fight or flight response. So when we're in danger, we have this surge of adrenaline, and that's the fight or flight response. And the opposite of the fight or flight response is the relaxation response. And the most common techniques are meditation and progressive muscle relaxation, deep breathing, mindfulness, imagery. There is no one technique for everybody. You know, in the 60s, people would go and, you know, learn meditation, and they were given a secret mantra of which there was none. But I feel like the kind of relaxation technique that works for you is, I could not tell you which one's going to work for you. It's like me saying, this is your favorite dessert, or this is the kind of ice cream you're going to like. You just have to try a bunch of different relaxation techniques. And so what I advise my patients to do is to just, you know, you can get all these apps for free for a week. You download, you know, either Calm or Happify or Insight Timer or any of these popular apps, and just try out a bunch of different relaxation techniques until you find one that works for you. And I can tell you, I've been doing this for a long time, and I still prefer, when I'm doing relaxation, to have somebody else guide me. It's just easier to do, and it keeps your mind from wandering. Next slide, please. So there are 2 benefits of doing some form of regular relaxation. You will feel more relaxed and less anxious during the practice and immediately after. So if you get home from work and you're in a frenzy, just go sit in a quiet place and spend 20 minutes meditating or doing progressive muscle relaxation or something, and that will make you feel better. But more important is, my old boss, Herb Benson, did a lot of research on, you know, why are monks so chill? Basically, what they found is if you do some kind of relaxation technique on a regular basis, you get what's called a carryover effect, which means you start feeling more relaxed and less anxious throughout the day. And so if, when you get stressed, you can't sleep, you'll start sleeping better. If you have, you know, irritable bowel syndrome, your bowels will get better. If you get anxious, you will get less anxious. So again, minis for me are number one, but if you're looking for something that's going to carry you through the days and just make you feel better throughout every day, you need to integrate some form of relaxation into your life. Next slide, please. So when people do this carryover effect, as I said, they start sleeping better, they have less headaches, they have fewer GI issues, they have less premenstrual symptoms, they have less shortness of breath, they just feel better throughout the day. Next slide, please. So as I said, it's really important that if you choose to do some form of relaxation, that you find a technique that you like and that works for you and is comfortable. I can't meditate. I don't know if you can picture this brain meditating. I actually hate yoga. But I love progressive muscle relaxation, and I love autogenic training, and I love body scan and breath focus and imagery. So you really do have to try out different techniques until you find one that feels right for you, because it's a very personal thing in terms of what works for you. Don't have someone tell you, oh, you have to do yoga, because you might hate yoga or you might love yoga, but you got to try it. Next slide, please. So there's a lot of inaccurate information out there about nutrition and fertility. First of all, there are no bad foods. I mean, unless you have celiac disease or you're diabetic or there are other things going on in your health, there's no food that's going to make you pregnant, and there's no food that's going to keep you from getting pregnant. There are no magic diets that increase fertility. Basically, and I worked with a really great nutritionist for 20 years. You want to eat good food. You want to eat the way your grandmother probably told you to eat, which means, lots of fruits and vegetables and lean meats and good fish and whole grains and nuts and olive oil and all that stuff, and, a little bit of chocolate. But just eat good food. I can tell you, and I'm not going to go into a lot of detail, and at probably some point we should do a webinar on this, but having a weight that is in the normal range is really important. Being too thin, whether or not you're a man or a woman, or morbidly obese, whether or not you're a man or a woman, can lead to lower fertility rates. No matter what treatments you try, no matter what drugs you take, if you are too thin or morbidly obese, it's going to decrease your chances of getting pregnant. And so eat good food. Just eat the good stuff. Next slide, please. So what we recommend to patients, because we're all human beings and we're all really, really stressed, and food can bring tremendous pleasure, is what's called the 80-20 plan. So if 80% of what you eat is the good stuff, like I said, fruits and vegetables, lean meats, fish, olive oil, nuts, seeds, berries, whatever you want to call it, the other 20% can be what you want. So I just had dinner at a friend's house and we had a really good dinner, and then she served cream puffs for dessert. So that was my 20%. And if you do that, you'll feel like you're eating well. You still get to eat some good stuff. Next slide, please. The reason the 80-20 plan works is because of this phenomenon that if you are being pretty careful about what you eat, and so for breakfast, you have your Greek yogurt and fruit, and for lunch, you have a salad with salmon on top and, dressing on the side, and you're feeling really good about yourself. And you're at work and someone brings in warm chocolate chip cookies or brownies or something delicious, and you have one, you will actually experience, and this is well researched, it's actually called the what the hell effect. It's like, oh, what the hell? I just had a cookie. I've blown my diet. I'm having fettuccine Alfredo and Haagen-Dazs for dinner. And that's what gets us into trouble, because what happens is we don't eat anything sweet or savory for 4 days, and then we eat a bag. So if 80% of what you eat is the good stuff, then eat the chocolate. Well, I'm a sweet person, or eat the chips. Next slide, please. So exercise has been a little more controversial in terms of what is the impact of exercise on fertility. And I think there's a general consensus now that people who do moderate levels of exercise have the highest rates of fertility. Exercise, honestly, is the best stress reducer there is. When I used to see patients physically in an office, I would actually keep a pair of sneakers there. And if I had a patient who had never exercised, we would actually walk during therapy, just so they could see how much better they felt when they moved. Walking truly is ideal. So if you are willing to try adding exercise to your life, I would try to exercise, maybe take a walk 30 minutes a day, a few times a week. And everything you do counts as exercise, like walking to the end of your driveway to get the mail, or walking a block to pick up some milk, or taking a flight of stairs. It all adds up. You do not need to go to an aerobics class for an hour or do a Peloton for an hour to count as exercise. You just ideally want to keep active throughout the day. Next slide, please. So the physical approaches, as I said, is do minis anytime you feel anxious, and try to think of things that make you anxious and do a mini ahead of time. Try to start some sort of regular relaxation practice for 15 or 20 minutes at least once a day. Follow the 80-20 eating plan, and try to add some form of exercise several times a week. Next slide, please. So what about the brain? What about the mind? How do we calm the mind as we go through this? So there are 5 different ways that I've come up with to reduce stress. One is challenging automatic negative thought patterns, social support, learning to express your emotions healthfully, self-nurturing, and battling perfectionism. Next slide, please. So the way I teach, which is called cognitive restructuring, how you challenge automatic negative thought patterns, is recognize what your brain is doing. And I used to say that if you think of your brain as being like a tape recorder and tapes play over and over again, but now I have patients that don't know what a tape recorder is. So I've got to think of some new analogy. But we do have thoughts that come over and over and over again. And for my patients, they generally are, I'll never have a baby, or the infertility is all my fault, or my partner's going to leave me for someone fertile, or I'm being punished for something I've done in the past. These are, I think, probably the 4 most common I've heard. I'm not saying they're the only ones I've heard because I've heard a lot, but I think these are the 4 most common. Next slide, please. And I think we just lost our slide. There we go. Nope. Next one. So if you actually examine these negative thoughts that play over and over in our head, most of them are wrong. You know, we have these, tapes play over and over in our head, and they either stem from something people have said to us in the past, or it's our fear being expressed. It's our fear speaking. Like we're afraid we're never going to have a baby. Next slide, please. So when I sit down with patients and I'll say, okay, write down your negative thought. So let's say my negative thought is, I'll never have a baby. And I ask them 4 questions. Does this thought contribute to your stress? Where did you learn this thought? And remember, I said these thoughts either come from something someone has said in the past, or it's your fear speaking. Is this thought logical? And is this thought true? Next slide, please. So, as I said, I think for most of my patients, the biggest fear they have, the tape that plays over and over in their head, is they'll never have a baby. So does that contribute to your stress? Yeah. Where'd you learn this thought? Well, my patients will say, I don't know. My doctor has never told me I'll never have a baby. Because if my doctor told me I'd never have a baby, I wouldn't be putting myself through all this. So it must be my fear speaking. Is it a logical thought? Well, the answer is if it was logical to say I will never have a baby, I would stop trying so hard. So it's not logical to say I'll never have a baby. But is it true? Is it true that I will never have a baby? And the answer is no. If it was a true thought that I'd never have a baby, you would mourn and grieve and move on and make other plans on how to live your life. But going through infertility, it's never logical and true to say I'll never have a baby. So how can you restructure it? And maybe you can just say, I'm doing everything I can to try to get pregnant. And that's a logical thought, and it's a true thought, and it's going to cause you a lot less pain than thinking to yourself, I'll never have a baby. Next slide, please. So as I said earlier, and I'm trying to hurry up so we can take questions, infertility can feel really isolating. You know, I can tell you, my parents went through infertility a very long time ago, and it took them 7 years to have my sister and 5 years to have me. And I remember my mom saying, no one talked about it in those days. And she felt so alone. And those were the days where people were having 4 or 5 kids. Nowadays, people are talking about it more. Certainly, we're seeing a lot more celebrities talk about it. I think the current data is 1 in 6 people of childbearing age have infertility. And so if you think you're alone, you are wrong. Because you do have relatives, and you do have friends, and you do have neighbors, and you do have family members who are going through infertility. They just aren't talking about it. So, think about, is there someone that you think might have infertility, like they've been married 5 years and they don't have kids, or they have a 6-year-old and they haven't had a second child, or maybe your boss has triplets. If you suspect somebody might have personal experience with infertility, maybe just say, mention the TV show Trying and say, thinking of watching this show Trying. It's about this couple going through infertility and see how they react, because it's really great to talk to people who get it and to understand how you feel. And, when I run these groups, and Prelude just launched this really cool new program called Fully Fertile Yoga. And it's like half remote yoga classes, but we also break people up into these small groups. And I've been reading a lot of the comments from people who are doing these groups, and it is just life altering. And these women are saying, I didn't realize other people felt the same way I did. And it's so great to tell a story and have everybody else say, yeah, me too. So getting social support is really important. Next slide, please. So there are lots of healthy ways to express emotions. As I said, most people going through fertility have anxiety and depression and anger and guilt and shame and rage and all these other things. So one of the healthiest ways to decrease these thoughts is to write about them. There's this really cool psychologist from Texas named James Pennebaker, and he's done his life's research on why writing about your thoughts and feelings is so great. So I have all my patients do this. And so basically, write about your thoughts and feelings for 20 minutes a day for a few days. And you don't have to show this to anybody. I'm not going to tell you what you should or shouldn't write about, but just write about how you're feeling. And it's extraordinary. I can tell you as a psychologist, you can almost put yourself out of business because people get so much better after they do this. Because when you write about your thoughts and feelings, you have catharsis, like you just feel better getting it out, and you get insight. Like, I've done this a lot of times whenever I get ticked off at my husband's family. And it's really amazing when I write, like, oh, now I understand why I'm mad, or now I understand why that triggered me, and wow, do I feel better? So think about keeping a journal just for 3 or 4 days and writing stuff down, and see if you feel better. Next slide, please. So I'm a huge believer in self-nurturance. I wrote a book on self-nurturance. It's hard when you're going through infertility to do nice things for yourselves, but people in general, when I talk about self-nurturance, they think I'm saying they're being selfish. And the difference is being selfish means doing things for yourself at the expense of other people, which means if you have one piece of chocolate cake left over and you eat the entire piece of cake and everybody else wanted it, you're being selfish. Self-nurturing means you share the piece of cake with everybody. It means meeting your needs in conjunction with the needs of other people in your lives and prioritizing yourself at the same level as people you love. And it's really important. So I was talking to a patient of mine today who's just a mess. And I'm trying so hard to teach her coping skills. And she's really in a challenging point in her life. And I said, I want you to do one thing for yourself every day. Just one thing. Wake up in the morning. The first thing you think of is, I'm going to call my best friend, or I'm going to go for a walk, or I'm going to go buy a cupcake, or whatever it is. And the cupcake is the 20%. But you have to do one nice thing for yourself every day. And it makes you look forward to it and just feel good about yourself. And it's really important. Next slide, please. So this is an exercise that I do with my patients. We're not going to have time to do it right now, but after this webinar is over, is just take a piece of paper and really quickly write down 20 things in your life that bring you joy. And then ask yourself, how many of these things do you do on a daily basis? So tomorrow, start doing them. Like if you love flowers, buy yourself one lily on a Monday and just smell it all week. Or, my husband and I are real chocoholics, and after 25 years, we realized that you can either go to a store and buy C's candy, or you can actually go online and go into the C's website and actually pick out all the kinds you like and just get a box of the kinds you like. That's been our 20% for sure. But it's also been a great deal of joy from eating chocolate we really like. Next slide, please. So perfectionism is really tough. A lot of us were raised to be perfectionists. Again, I wrote a book on perfectionism, and there's nothing wrong with wanting to be a good daughter, a good wife, a good friend, a good employee, a good family member, a good housekeeper. There's nothing wrong with that. Next slide. But if you feel you have to be perfect in everything you do, it's going to lead to a lot of anxiety and a constant sense of dissatisfaction. And so what you want to do is think, what's most important to me? Is being a good daughter really important to me? Okay, maybe being a good daughter is more important than vacuuming every day. Or maybe being a good partner is more important than putting 110% into your job. You can't be perfect in everything you do. So be good enough in some areas and be really good in the areas you care about. Next slide, please. So, for my job, since I live in Boston and work in Houston, I fly a lot. So I really want my airline pilot to be a perfectionist when he or she is flying the plane. When I fly, on Saturday to Denver for the reproductive medicine meetings. I want my pilot to be a perfectionist, but I do not care if they are a good tennis player. If you go out to dinner, you're going out for a birthday dinner, you want your chef to be a perfectionist in the kitchen, but you don't care if they make their bed. And so the same thing applies to you. Push yourself in the areas you really care about, but not in everything. You gotta let you can be good enough in areas and still be amazing. Next slide, please. So in summary, and then hopefully I'll take some questions. Challenge these automatic negative thoughts, restructure them to be logical and true. Try to find other people who have gone through infertility, are going through infertility. Check out Prelude Clinic's fully fertile program. We're subsidizing every single person who goes through it. So it's not expensive, and you get to learn some amazing fertility yoga, and you get to meet some really cool women. Get a journal, keep a journal, write down your emotions, nurture yourself without feeling guilty, and battle your own perfectionistic tendencies. Next slide, please. So that's it. Can you guys see me?
Yes, I can see you, Ali.
Okay, so I want to tell you that I got a paper jam in my printer, and I've spent 3 weeks trying to take apart my printer and could not figure out how to fix it. And a friend of mine's an engineer, and so she said she'd come over today to fix it. I spent 2 hours cleaning up my office. So I want you to notice that there's no clutter behind me right now. And she walked in and said, wow, your office is so cluttered. I spent 2 hours cleaning up my office. So I'm even brave enough to unblur it so you can see how uncluttered my office is. Do we have any questions, Irina?
We do, Ali. The first question is, how can I combat the feelings of running out of time due to my age?
You can't. Unfortunately, we can't stop the clock. And so the answer I would give you is, okay, as one goes through infertility and infertility treatment, there are some things we can control, and there's some things we cannot control. So you cannot control your age, but you can control your lifestyle habits. You can control your stress levels. You can control how carefully you take care of yourself. And so all of those things that I described about nutrition and exercise and all those things, those are all things you can control. And so, for example, I didn't go through this, and I did do a webinar in the past, and I'll do one again on lifestyle habits. But the craziest statistic I've seen is a 25-year-old smoker is as fertile as a 35-year-old non-smoker. So smoking adds 10 years to your age. And so I would far rather see a 40-year-old who doesn't smoke and has a normal BMI than a 25-year-old who smokes and is morbidly obese. So think of the things that you can control and focus on that, because the things you can control are going to increase your chances.
Thank you, Ali. The next question is, what are some ways to navigate infertility discussions when people ask, how is it going, especially if you have different religious or political views?
Oh man. So I'm a big believer in what I call snappy comeback lines. And what I suggest to all my patients is think of the things people say to you that drive you crazy. No matter what it is, that's politically insensitive or religiously insensitive or weight insensitive or whatever else, and memorize, 3 responses. So you come up with whatever someone asks you or says to you, and it never ceases to amaze me, by the way, what stupid things people say to my patients. But think of 3 ways to answer a question or to respond to an insensitive comment. The first is polite. If someone says to you, if you'd lose some weight, you'd get pregnant, which people say to patients all the time. And a polite response is, oh, thank you for your concern. Okay. Then the second one could be to educate and to say, okay, there is some data to show that weight may have an impact on fertility, but my doctor and I are talking about it, and I'm pursuing treatment that is going to really increase my chances of getting pregnant despite what my weight is, or whatever else. And then the third one is zingers. So you've got a polite response, an educated response, or an educational response. And the third is a zinger. So if you think someone is saying something to you with the intention of being cruel or nasty or judgmental, zing them right back. And sometimes you need to do that. And I know I'm a very non-confrontational person, and I understand the discomfort one has. But sometimes if someone is being mean to you, you need to be mean right back. And it's easier because I'm the kind of person that if someone says something mean to me, like my friends saying my office is still messy, in 3 days, I will think of a response. I don't think on my feet. If someone says something, so you have to memorize things that you can say back so that you're never caught off guard.
Thank you, Ali. The next question is, I often hear people say, I don't know why so many women battle infertility at the moment. Infertility was never a common thing back in my days. Why is
Okay,
this
well, I
happening?
can tell you right now that is so not true because my parents went through it. And when I think back to the neighborhood I grew up in, there were a number of houses that didn't have kids. So infertility has always been around. Since literally the story of Hannah in the Bible talks about infertility. So it's been around forever. It's also not just women. And we keep on talking about women infertility. You know, almost half of all cases of infertility right now include a male factor. It's not just women. And in fact, in Europe, sperm counts have dropped almost in half. So it's not just women. Um, People just didn't talk about it in the olden days. Like my mom said, people never talked about it. People are talking about it more. It is probably more common because people are waiting and trying when they're older. And we know that age is not our friend. There are also a lot of environmental factors. You know, we don't know what in the environment per se is doing this, but there are environmental factors. And many more people are obese. And that also impacts fertility.
Thank you, Ali. Another question we have, do you do classes like mind, body, and how can our patients enroll in those classes?
So as I said, about 3 weeks ago, ta-da, we launched this fully fertile yoga program. And the first 286 Prelude patients who signed up got it for free. And for the next however many thousands go through it, their clinic is subsidizing a third of it. And so the cost of the program, I think,
100,
is $110 for the 6-week program.
140.
140, sorry, 140. You get 110 off, whatever it is. And it's 6 sessions. And as I said, like half of it is teaching relaxation strategies like yoga, and half is making it a support group. And I've watched now some of the videos from people who I think we've had 3 classes so far for the first group. And it's amazing. And we started another group last week. And then in November, we're starting the first Woman of Color program. And we're just going to keep on offering these groups to our Prelude patients because people need it. They need, you know, the skills of relaxation strategies like yoga, and they need each other.
And the good part as well, to add to Ali's comments, those sessions run online because we do have questions around around this topic. You can do them in any city. You can connect the patients from all over the country.
And these are for our clinics throughout the US and Canada, right? It's everybody.
Correct, yes.
Yeah. You just have to be a Prelude patient.
And Ali, the last question we have for today, will you please repeat the alternatives to yoga that you recommend trying?
I will list all kinds of different relaxation techniques. As I said, I literally have the Calm app on my phone, and I've been teaching relaxation for almost 4 decades. I still like guided relaxation. So it's a very individual thing. I would say you could try progressive muscle relaxation. You could try autogenic training. You could try imagery, breath focus, meditation. I'm running out. I'm blanking. It's late. But you know, if you go on one of these apps, and the 3 that most people talk about are Calm, Happify, and Insight Timer, there are thousands of guided relaxations. One of the reasons I like Calm is you can choose a guided relaxation by someone with a British accent, which is really fun to do a relaxation guided in a British accent. But there is a relaxation technique out there that's going to work for you. I have never in my career had a patient that couldn't find some strategy that works for them.
Ali, we just received two more questions. I know we're running
I'm
out of
good.
time, but I hope you'll have a couple of minutes to answer.
I'm happy.
How do you respond to someone who says, "Have you considered adoption?"
Well, again, I'd have three responses. I'd have polite, education, and zinger. So polite would say, we're considering lots of options. An educational one would be, we're considering lots of options. Adoption is actually very challenging in the US, very expensive, but we haven't eliminated it. And a zinger would be, have you considered adoption? Why did you have children biologically? Why didn't you adopt? I can be mean when I need to be.
And the last question for today, how do you recommend finding a therapist who is familiar with infertility?
That's a really good question. So I'm actually working on doing that for the whole Prelude Network. But I think the best way to do it now, there are two ways, is ask your physician, because almost every infertility doctor has some kind of relationship with a mental health professional in their area, and they refer. If your infertility doctor does not, and please tell me that I'm hoping and assuming every Prelude physician has a relationship, you can go to the website of the American Society for Reproductive Medicine. So the website is asrm.org, American Society of Reproductive Medicine.org. And there's a mental health professional group. So it's MHPG. And they list, I think there's 700 or 800 of us in the country. And I actually don't know what the equivalent is in Canada. I'm assuming it's CFAS has the same thing. But ASRM lists the 700 or 800 people by state who specialize in counseling people who are going through infertility and or pregnancy loss. And they tend to have special training. A lot of them have personal experience. And they know. I mean, when you walk in and talk about an IUI, they're going to know what that is. When they talk, if you go in and say, my sister's pregnant and I cried for 4 days, they're going to consider that normal.
Thank you very much, Hattie. That concludes all the questions that we have today. I hope all the patients enjoy the webinar, despite the technical challenges that we experienced in the beginning.
Sorry. Yeah, we'll figure that out the next time. And we're now having webinars every month. So please keep your eye out for I couldn't even tell you what the next ones are, but Arena has booked me for all of 2025.
Thank you for your time today, Ali.
Thanks, Arena. Thanks for arranging
Have a good
this.
day.
Bye, everybody. I wish you all the very best of luck.